From
the New South Wales Aboriginal Land Council, this is the A Cuppa and a Yarn podcast.
Well, at the moment, it's touch wood. We haven't no cases yet to trigger the next level of guest support. What we have done, we've issued out a notice last week about the actual stopping all the non-essential services coming in. And I've been hammered left, right, and centre with phone calls, getting an interpretation of that. So obviously the local providers probably were concerned about what services they can deliver here, and they're all essential. So I've identified the essential ones, and the ones that aren't essential, well, they've already emailed me back saying that, we'll postpone this or cancel this until such time of further notice and all that. So the messages are getting out there. As a flow on from that, because of things changed dramatically on the weekend, we've established a Toomelah crisis management group, because they really haven't, since they've been established, really haven't had anything like this come or anything set up anyway for any other stuff besides, flood mitigations and fire emergency service stuff. All the normal things, but not to this level. So really we started discussions yesterday. We formed a committee group from the community that have vested interests or key stakeholders, and we started identifying some issues, and obviously one of them is the access to Gundawindi, because yesterday Queensland government announced that they're going to close the borders as of tomorrow, midday or midnight or something like that. So we got to figure out what that really means for us, because it's our main hub. Gundawindi is for all the essential services we need for the community, and essential services coming in as well.
Have you been contacted at all from any Queensland official, etc., about this, or you're still seeking that information?
No, we haven't. We've only had Dun and Downs Health. They've set up a sort of like an Indigenous pandemic support team, and they wondered because they were doing all along the border as well, they were wondering what has been done for us. And I said, well, virtually nothing. So I said, just put us down on the list, because we utilise those services daily. Because we don't have an arrangement with Moree is the closest one, even because Moree brings services us with the doctors and the Hunter Health and Pius X and that sort of stuff, because we have a clinic in the community. But there's more than just the medical side of things. There's, the access to the food outlets like Coles or a co-op that's like / Foodworks.
Just for anybody listening who's probably may not be aware of how you're positioned. So with Toomelah, you say, Gundawindi is your main hub, and that's over the border, yeah?
Yeah, that's over the Queensland side, yeah.
Yeah.
Because they've got the facilities, they've got the medical centres, the hospitals, the chemists, and everything else. Food, you name it,
So,
and shops and all that. What we
sorry, how far is it to drive from Toomelah to Gundawindi?
Well, about half an hour. Yeah,
Yeah.
30 minutes.
And to Moree?
Hour and 30 probably.
Right.
Depending on the roadworks, because there's roadwork going on left, right, and centre. As in Boggabilla, our local town community, we don't. There's no shop like a handy store or anything there. All they've got is the garage for petrol and whatever the knickknacks they sell out of there, and they've just reopened the cafe next door only recently. It was shut down for quite some time, a few years, and I think the main shop in town has been shut for several years. So we've got no choice but to go to Gundawindi because it's the closest.
So you really want
get everything there.
You want answers now, don't you, about that? Because
we want answers today, or as soon as they announced closure, or answers when they were all the other states have already shut the borders. We want to find out what that model is. Well, we don't know. We're still unknown.
So with the committee,
so what that means for us.
Yeah, it sure is. With the committee that you've set up, you said there were a number of key stakeholders identifying those issues. Have you been able to, you know what it's like when you're dealing with, I guess, government departments and etc. Have you found the person or the people yet who, when you can talk to them, you're going to be able to get some answers? Are you there yet with that?
There's information starting to circulate obviously, when I sent that notice out, that triggered a lot of wake-up call for everybody down in the state that's under the LALC banner, that we're putting ourselves on the front foot. In saying that, we also need what are the support mechanisms in case we get locked down, as in lockdown, so nobody's allowed in or out to the community, and that was last week. Now this week, the Queensland border is going to be closed down. So, what does that mean for the local community people? Because there's 200-300 people here, when we're remote because we're not a mainstream community. We're an Indigenous community. And we're isolated. We're 15 minutes from Boggabilla, out on a lot, on a big block that's been handed to the community way back when it was first established. So there's and a lot of the people here have chronic conditions, so they need ongoing care, whether it's medical or food or whatever form it takes to maintain a healthy lifestyle and to survive basically in the community. And we have a really high unemployment rate, and welfare dependency is probably 90, up there in the 90s, I'd say, percent. So they rely on access to that Gundawindi as the main services, essential services. So it's happening. So we just got to make sure we can nut it out a bit more, because we're developing an action plan out of the workshop that we'll do. It'll take a couple more days. to get to that point, and then we'll circulate it to NSWALC, because Ann Dennis is quite keen to get our response as well, because nobody else has done anything else in any other LALCs.
So this action plan, this is going to include, I guess, all of the issues, where they're at, what needs to be done, who needs to be involved. Is it that sort of thing?
Yep. It needs to be, we're going to sort of fine tune it, identify it all and put it in the action plan. Then we're going to delegate the task to members of the committee, so that we can, keep a weekly check or report on it weekly to see how things are progressing. And there's other things in there that are sort of like in the too hard basket in regards to funerals as well. That's one of the key discussion points, because there's a couple of deaths in the community in the last couple of weeks. One young fellow and one old fellow. So how do we manage that as well? Because we don't want to not let them do the right thing and pay respects under the cultural banner. But we're discussing that tomorrow. Got a hold of an urgent board meeting as well tomorrow, so we can fine tune all that and get that resolved, and that'll set the precedence for anything else that comes down the track. We don't know how long. Well, nobody knows how long we will be sort of like isolated from each state. So it'll limit our movements big time. And obviously the community of this size always somebody will find out what somebody's done, whether it's right or wrong.
Yeah, absolutely.
We just got to be prepared to be able to deal with it. That's about it. So all the signs here are good so far. I mean, all we probably waiting on is, don't want to put it into the wrong context, but if a case is reported, then we need to trigger those emergency sort of services, the support services, to get out here. And if the community is locked down, and set up a temporary isolation ward somewhere on community, that means we need the professional medical staff, and everybody's like, even the clinic is short staffed, and they wouldn't have the capacity to maintain or monitor the outbreak of any size, or if one gets in, you can bet your bottom dollar it'll go right through.
So, Rex, what I'm hearing is, and especially with the action plan that you're developing, and I'd love to have a chat with you if we could, once that's all sorted out and you know what you're going to follow 100%. You've got food and other essential items. You've got medical needs, and you've got what are the plans going to be in case of an emergency, i.e. a diagnosis and isolation. Those first two, food and medical, how crucial is it that the Queensland government communicates with you clearly now about how that's going to work for you? Is that pretty crucial? That has to be a today?
It's very critical. It's crucial. It's a crucial and critical, because we only go in every now and again, once on, when they get allowances and they buy whatever they need. But then you've got people just coming and going as much as it needs, and depending on the health related issues that people have, because you've got all ages and all sorts of conditions here. So we need to make sure that we can have that. I mean, have that support come in, even from the ambulance, and what time frame it means if a patient gets critical, and you know, and then they need to be isolated. There's no good to bring them back into the community because they're going to infect the rest, you know. So either that or the community sets up a temporary triage ward, and we've suggested that maybe they can use the building here that's quite large as a temporary setup. And then the other flip of the coin is that we may need to set up a distribution centre for the food in case they need to do food drops to us in pallet form and things like that. We'll need refrigeration, and you know we've got a couple of freezers and a fridge, and that's it. But to keep things fresh or store it for a period of time, those are some of the things we need.
What is going to happen for you, say for the rest of today, Tuesday, going into tomorrow, Wednesday?
We've got a board meeting to finalise a couple of issues.
Yep.
And then straight after that, go back into the workshop mode to nut out the finer details of the action plan.
Yeah.
And then we get that out, and then we see what the closed border breakdown is, what it means for this community. People will need to quickly get that needs to be communicated as sort of ASAP, because there's a few people that come from Goondiwindi also to provide the service as well, and that includes me. I come from Bogavilla, come here to work in here, so NSWALC has obviously been instructed to work from home, so I've got to get that ratified tomorrow. So I won't be here physically, but I'll be on work out how am I going to get that continue operation.
Yeah, absolutely.
But there's got to be somebody here once a couple of hours a day. We'll establish that tomorrow on opening, and I guess because we're on the front line, we want to limit that exposure.
Yeah, indeed.
Yeah.
How's the community feeling at the moment, generally? Some of your people you've been talking to, is everyone sort of doing okay? Because I mean, it's huge, this thing.
Yeah. Well, I guess there's a fair bit of anxiety out there, and they're all waiting for about what happens with the border tomorrow. That's the key one.
Yeah, it sure is.
So that's the big one. Yeah.
You can do Nayania Baraya, Nayania Manania, Manania, Manania.